What's up guys, my name is Dr. Pham. I'm a board certified dermatologist and PharmD. Welcome to my channel. Today I'm going to be talking about a very important topic. In my practice, I get a ton of questions on what vitamins should I take to get my hair to grow, and almost always I get asked about biotin. And so today I'm going to break down all that information for you. We'll take a deep dive in science, and we're also going to see what I'll recommend. And you might not like what I'm going to say, but I'm going to say it. So let's go. So what is biotin? Biotin is a water-soluble B vitamin, specifically B7, and it is extremely important for our body to function correctly. Its role is to help the function of our enzymes, specifically carboxylases, to regulate the metabolism of glucose, your fats, your proteins. And more recently, we've discovered that biotin is important in the way our cells communicate and the activity of various genes. Biotin's role in the production of keratin, which is the protein that make up your skin, your hair, and your nails, is the reason why it gets promoted so heavily, specifically on the health of your skin, the health of your hair, and especially for hair loss. But wait guys, watch until the very end. I'm going to show you the science and the data, and we'll draw our own conclusions on this, okay? The next question to answer is, where is biotin found? Now, besides in these vitamins and supplementations, biotin is extremely common. It's found in a lot of normal foods that we eat every single day. This includes wheat, breads, whole grains, cereal, chicken, salmon, dairy, peanuts, soy, you name it. I'm getting hungry just listing all of these foods. So you may ask, how much biotin then do you actually need? And according to the National Academy of Medicine, which sets out guidelines on how much daily vitamin you need and how much is considered adequate intake, as you can see, it's not very much. As an infant, you only need 5 micrograms per day. As an adult, 25 micrograms per day. Now it looks like if you're pregnant or breastfeeding, you might need a little bit more. And supposedly, this state will increase the metabolism of biotin in your body, thus requiring additional intake. But this data honestly is a little preliminary and a little bit controversial, so take that with a grain of salt. The average diet will yield you 35 to 70 micrograms easily. So take a look at these foods. So in a cooked egg, you can get up to 25 micrograms per day, depending on how big the egg is. Cheddar cheese will get you 2 micrograms. Salmon can get you up to 5 micrograms for just 3 ounces. I usually eat like 6 or 8 ounces of salmon. Whole wheat bread gets you 6. A cup of raspberries, which is one of my favorite fruits, will get you about 2 micrograms. So plenty in your regular foods. All sounds super delicious. So snack on an egg or eat a sandwich, y'all. Now the good news is that you can't actually overdose on biotin, nor are there any reported toxicities of taking too much biotin. Because like I mentioned before, it's a water-soluble vitamin, meaning that whatever you take that your body doesn't use, you will eliminate it through the urine. Think of it as a small 6-ounce cup. If you can continue to fill with water, it's only going to fill up to the brim, and then any more of that will just overflow. But that doesn't mean it's not going to cause problems, and I'll talk about that in a minute. The next important question is, who actually needs additional biotin supplementation? So biotin deficiency is extremely rare in people who have a normal, healthy diet and are otherwise normal. There are instances, though, supplementation is actually necessary medically. And this is in patients or little infants who have a congenital metabolic disorder where they cannot use or absorb biotin. Now, these congenital metabolic disorders are extremely rare. The prevalence is 1 in 140,000 people. Babies with biotinidase deficiency cannot absorb biotin, and the babies with hollow carboxylase synthetase deficiency have a normal amount of biotin but just can't use it very well, and so they require higher levels of biotin due to increased demand. Now, besides the congenital problems, you can actually have an acquired problem, meaning that although you're normal, there's something that's happened that you can't use or absorb, or you're just lacking biotin. The first is eating a lot of raw eggs. Now, egg whites contain a protein called avidin, and avidin binds very strongly to biotin and inhibits its absorption. Now, as you can imagine, there's one way around it. It's very easy. I'll let you take a guess. You got it. You just cook the eggs. When you heat up egg whites, the heat itself will denature the protein and no longer causes a problem. The second reason why someone might have an acquired biotin deficiency is chronic alcoholism. And usually in this setting, you'll see deficiencies in other vitamins as well. B1, B2, B3, B5, B6, B7. I can go on. Now, a glass of wine every night is okay, but I'm talking about the bingy types of behavior where you're drinking lots of alcohol, leading to very poor diet as a result. Chronic alcoholism, alcohol addiction, alcohol abuse is a big problem in the United States. If you or someone you know is struggling with this, please reach out and get some help. Get the support of family and friends to get you through, because it's hard to do this alone. The third reason for biotin deficiency is smoking. So we think that smoking increases the metabolism of biotin. This data is a little preliminary, but it suggests that. Either way, smoking is bad. Say no to butts. Reason number 4 is taking anticonvulsants or medicines that help with seizures, specifically valproic acid or the brand name Depakote. It can cause a relative biotin deficiency, but that doesn't mean stop taking your medicine, okay? We don't want a seizure. Keep taking your medicine. Lastly, when you have problems with gut bacteria or the microbiome or the flora, this might impact the way that your body is absorbing biotin or decreases the absorption of biotin. If you have bowel problems like Crohn's or other inflammatory bowel disease, that could also impact your ability to absorb vitamins as well. This is more for fat-soluble vitamins, but again, when you have an inflamed bowel, anything could happen. The next question to address is, what does biotin deficiency look like? So when you are deficient, usually that presents as a chronic rash or eczema-like skin, or the other thing is called seborrheic dermatitis, where you have a buildup of a common yeast that causes inflammation around greasy areas of the skin, that's around the nose, around the eyebrows, and the scalp, almost like cradle cap for babies. And then other things is dry skin, brittle nails, and hair loss. Non-skin symptoms include depression, general fatigue, and seizures. So guys, you know I like to look up primary literature to try to dig into the data, and I tried to ask the question, what is the evidence that biotin actually helps with hair and nail growth? And guess how many articles I was able to find? Zero clinical trials that show biotin is actually helpful. But I did find one study that was published, and this study reported improvement in hair loss in children with congenital metabolic disorders. So these are the patients who, again, we have biotinidase deficiency or holocarboxylase synthetase deficiency, who were given extra biotin and showed improvement in their skin and improvement in their hair. No studies were available for healthy individuals in a clinical trial setting that shows that biotin is helpful. So the authors in this article concluded that in someone with a congenital or an acquired biotin deficiency, biotin supplementation may be of benefit. So the corollary to that is, in an otherwise healthy individual, taking extra biotin supplementation will not help. Now you may ask, Dr. Pham, will it hurt for me to just take it? It's just a vitamin. Well, I would be really tempted to say it wouldn't hurt, but that would be doing you a disservice. Because where it's problematic is that it affects the lab results of some very important diagnostic tests. In 2017 and again in 2019, the FDA put out a warning because someone actually died from a cardiac arrest or a heart attack because they were on biotin and they had falsely low troponin. Troponin itself is a protein marker for cardiac damage that gets elevated during an acute heart attack. Guys, someone literally died, okay? But still to this day, no one's listening. People are still taking biotin. But it's important to realize though, some heart attacks are painless. This is more common in women and patients who have diabetes. And so we rely on these cardiac markers to help us make important diagnostic decisions and treatment decisions. So if it's wrong, doctors will be making medical decisions based on wrong information, and that's deadly. Other labs that it could affect are your thyroid hormone labs. Biotin has been shown to falsely elevate your T3 and T4 or active thyroid hormone that's floating around the blood. The other component is that it could show falsely low levels of TSH or thyroid stimulating hormones. Now the way it works is when TSH is high, it tells your thyroid gland, hey, we're low on thyroid, please make some more. As you can see, if this number is wrong, it could lead to a misdiagnosis of hyperthyroidism or too much thyroid hormone, or the dosing from the thyroid hormone supplementation that you take is too high. Other lab interferences include DHEAS or dihydroepiandrosterone sulfate, luteinizing hormone, follicle stimulating hormone, HCG or the marker for pregnancy, HIV, hepatitis, and some tumor markers, and vitamin D as well. So lots of them. Now to be sure, the false readings are only associated with certain manufacturers of the test, but you would never really know which test was used for your sample. So if you're already taking biotin and you're gonna have your labs done, I would wait about a week and then get your blood drawn to make sure that the lab readings are accurate. So guys, after all that, my final thought on biotin is this. Biotin is not helpful in patients who are otherwise healthy, eating a healthy diet, and it won't help in promoting hair growth in patients with hair loss. I actually hate that biotin gets so much publicity on the use for hair growth because for me as a dermatologist, my patients come with hair loss and they're already desperate, they're already stressed, they're already depressed that their hair is falling out. And when you see things that get advertised that give you a promise that your hair is going to grow back, the hope that your hair is going to grow back, of course when you're desperate, you're willing to do anything. A stressed brain can be convinced to do anything. But the reality is, this is extremely misleading because we know that there's no use in healthy people and it could potentially hurt. So here's the truth. If you are experiencing hair loss, there could be multiple reasons why this is happening. So it's important to get in contact with a dermatologist who can work with you and get through the evaluation process and see what you actually need. Don't assume that taking more vitamin is going to help. Don't assume that taking vitamins is safe. And if you're already experiencing a lot of hair shedding and excessive hair loss, I made a whole video on that. I'll leave a link right up there. Watch that next. Alright guys, here's my final tip and what's gonna be better than taking a pill for biotin supplementation is to eat a sandwich. It tastes way better. That's all I got for biotin today. Thank you for sticking till the end. Thank you for listening to my rant on biotin, and I hope you learned something. I'm dedicated to giving you good information on how to take care of your hair and your skin. And guys, I love that we've been able to communicate through YouTube on the comments. So keep throwing me those questions. I'll get right back to you. My hope is that we can continue to grow as a community, you and I. So please subscribe so you don't miss that next video. I'll be putting one out every week. Next week's topic is going to be on microneedling and how to use microneedling for hair loss. There's some data out there, so I love to break it down to you because that's what I do. And so guys, thank you so much for your support. I hope you have a great hair day, and I'll see you in the next one.